Well, let's move on a little bit to the post-operative course. And I'm assuming that you've already said that everything is worse. Tell us a little bit about the post-operative course.
The post-operative course, initially, we worry again about the increased blood loss. So for the first 24 or 48 hours, we find that we have to take a careful look at the patient to make sure their blood counts are normal and they don't drop. Scar tissue often has a lot of bleeding, and when you thoroughly remove it for a revision knee replacement, you will get more bleeding. Now, we're using a lot of new techniques, such as trying to seal the bleeding surfaces with sprays, various what's called fibrin sealants. But even with these new techniques, you're going to get more blood loss. So the first 24 hours, everyone is on a more careful watch than a primary. Not to say that we're not very careful with a primary, but it's a degree of intensity. And I will find with a number of my revision knees, they will more likely go to what's called a monitored bed, which is a step-down unit or an ICU for 24 hours, just due to the magnitude of the surgery. The second thing is that in the post-operative period, I expect, as we talked about, a little bit more pain. So though we get them up the first day after surgery, I don't expect they'll be moving quite as quickly. But the protocol, surprisingly enough, in the post-operative period is almost identical to that of a total knee replacement. We get them up early. We often use a machine that moves the leg at least 4 to 8 hours a day when they're resting in bed. We start physical therapy once, twice a day, and we get them walking as soon as possible. So I don't put any special restrictions on the post-operative physical therapy program with my revisions.
Now, what about hospital stay? Do you find that people who have gone through a revision knee replacement stay in the hospital a bit longer than your primaries?
I think if we were going to look at a large number of revisions, which I do, we'll find our hospital stays certainly average about 2 days longer. A lot has to do with the timing of getting out of the intensive care unit or the first days or the needing of a blood transfusion. It's not very common for me to have to give a blood transfusion after a primary knee replacement, but it is common to need 1 or 2, and that could delay the hospital stay a couple of days. I don't find that either pain or lack of motion delays my hospital stay. It's usually the blood count, or a medical reason that would delay the hospital stay. Keep in mind, when somebody fails a primary knee maybe 15 years after they first had the operation, they're 15 years older, and they may have quite a few more medical problems than they might have had on the very first knee replacement. And all of these, in large groups of patients, contribute to a slightly increased length of stay on average, in our hospital at least.
And after the patient is home, I mean, what's the difference between the revision and the primary? How fast can they, get to doing things like driving, like going upstairs, get rid of crutches if they're using them, or a walker? Do you find that the revision total knee replacements are a little bit slower to come around with those activities?
I think they are slower to come around with those activities. Don't get me wrong, I will find many revision patients who after the surgery bounce back as fast as a primary. And those patients do exist. So if you're going to get a revision, you shouldn't assume you're going to go slowly. But again, if there were 100 patients and we'll define primary knee replacements as getting back to activities 10 out of 10, revisions go at a speed of about 7 out of 10. Everything's a bit slower. For example, though not a rule of thumb, oftentimes I could have a primary knee replacement who I did their left knee probably start driving at about 4 weeks, certainly no later than 6. Right knee, they probably don't drive for 6 weeks, probably 8. On a revision, they may not drive either knee for at least 2 months due to the swelling, the pain, the lack of motion got there early. So revisions in general move a bit slower. The good news is that a knee is a very resilient joint. It can have as much as 18 months of time to fully rehabilitate. So while it is important to get early motion, patients should understand that they could continue to improve each week for many months after the surgery.
Well, I think you've probably answered my next question, and that is, when do you sit down and tell patients they're going to be pretty much as good as they're going to get, and they can put this behind them, and the status of their knee at that point in time is pretty much going to stay relatively static? It sounds like to me that you're suggesting that this can improve up to 18 months. Is that accurate?
Well, that's a good average to say that I've seen some patients at a year improve a little bit more, but a majority of the improvement happens in the first 3 months. Now, I like to tell primary total knee replacements that at about 3 months, you're pretty much there. Now, you may improve with your feeling of flexibility and knee feeling better, but the motion you get at 3 months is usually about 90 to 95% there. Revisions sometimes take as long as 5 or 6 months to get to where they're going to end up. They need sometimes a second or third procedure. Now, when I say procedure, I don't mean an operation. I mean something called a manipulation under anesthesia. If I was to take my revision patients, they require more manipulations under anesthesia in the post-operative period than my primaries. A manipulation under anesthesia is maybe at 8 weeks afterwards. If they're lagging behind in motion, I will bring them back to an operating room. We will give them anesthesia for no more than 2 to 5 minutes, and I will bend the knee to break up some scar tissue to further along the physical therapy process. So I tend to keep my revision knee replacements on a bit shorter leash after the surgery because I know that they scar in more easily and I don't want them to fall behind, and I will manipulate them in an operating room 2 or 3 times when I wouldn't even do that in the majority of my primary knee replacements.